Tate Chronicles now transmitting.
Welcome to the Tate Chronicles on Healthcare Now Radio. And now, here's your host, Jim Tate.
Good day, citizens of the free world. From border to border, coast to coast, and to all the ships at sea, I bring you a warm welcome. This is your correspondent, Jim Tate, and thank you for tuning in to the Tate Chronicles. Join me as we cut through the fog that exists at the leading edge of healthcare delivery and technology. My guest today is Rick Moore, who's the founder and CEO of the MTC Group. Rick is a recognized leader in the health information technology space and is well known for his ability to work with the extreme complexities of health information management. Rick, welcome to the Tate Chronicles.
Hey, Jim. Appreciate you having me on your show here and all that you've done in the industry as well. So thanks for that introduction. I feel like hopefully I can live up to it. So looking forward to the discussion.
Yeah, me too. Well, first, Rick, tell us a little bit about your background and what led you to founding the MTC Group. What services do you offer, and who are your primary clients?
You bet. It's I guess what they say is with age comes wisdom, if you will. But after about 40 years of professional employment and climbing the corporate ladder, if you will, I spent 20 years in the military. So I'm a retired Air Force major. While I was in the Air Force, I had 4 different career fields. And in those career fields, I noticed no matter what I was doing, technology was a major player, whether that was working on the missile silos in Cheyenne, Wyoming, that were, poised to deliver the defense of the nation's freedoms here that we have in ways that I would never want to see happen. But that was where my intro to technology happened. I went into civil engineering right after that in the same place, Cheyenne, Wyoming. And so started setting up computer networks for computer-aided design and drafting. You're talking about the mid-'80s. And I had this eye or this vision to be in healthcare. And so in the midst of doing that, I went ahead and got my commission in the Air Force and became a logistics officer, and was in Japan at the time in the mid-'90s, and finally was able to get a graduate degree in management. And the Air Force thought I was worthy to become a medical service corps officer. For my last decade in the Air Force, I was a medical service corps officer, and in that role, basically a healthcare administrator. And it was there where I really found technology was completely lacking, if you will, in many ways in healthcare, and particularly when it came to the operations and delivery. So that's where my propensity for picking up the knack of building operations that were supported by technology came into play. And that was when I became a strong advocate for what it takes to really deliver better healthcare. It's going to be supported by things like technology. And so after I spent a decade doing that, the Air Force sent me off to the University of Alabama, Birmingham, where I got a health informatics degree. And that was really my formal education in health IT, so to speak. And it was from that springboard that I went back to the Department of Defense and rolled out the electronic health record for the deployed troops from 01 to 03, from 03 to 05. And then I retired in 05 and went into public sector, a not-for-profit. I was at the National Association of Children's Hospitals, formerly known as NACRI, now it's known as CHA, the Children's Hospital Association. And there I was their director of hospital health informatics, where I pulled together from 200 hospitals all the data to do quality improvement for those hospitals in advance. Basically what I noticed there was the lack of standards in healthcare interoperability. And that was my first, if you will, exposure to a non-integrated delivery health system, where I was in the military, an integrated delivery network. That was where I really picked up sort of I'd call it the awareness that our healthcare system in America was woefully ill-prepared for the oncoming onslaught of technologies that were going to hit it. And clearly we've been behind for some measure of time. And it was about 2008 when I was able to go to the National Committee for Quality Assurance and become their chief information officer, where it really came in a stark contrast. So for the last 14 or so years, I've really worked at the forefront of national policy on health reform, and things like our high tech, meaningful use, and all those things that went into where we are now, trying to go from a fee-for-service industry to a value-based payment, value-based contracting, you name it, but basically trying to move the industry from just churn and earn to a truly value-based, I'd call it, getting what we pay for. And so go ahead, Jim.
Sure. Well, and so, and so you founded the MTC Group, and who are your clients? And what services?
Yeah, that's a great point. So, yeah, I was headed that way because what I saw after, like I said, better part of a decade at NCQA was that while we were able to make all these wonderful, I'm going to say policies around where the country needed to go, what I have witnessed and now have really been exposed to is that there are a lot of folks out there very confused about how to get there and what to do. And so having been far removed in many cases for some time now from the direct care operations, I wanted to get back to that. I wanted to get back helping where the frontline workers are at, if you will. And COVID kind of put that in stark contrast. I think the pandemic has illuminated the need to get out and put people on the front lines that really know how to make this happen. So I felt like I could help these organizations that were struggling with strategies and ways to help them understand what does it mean to go from where they are to where they need to be. And it's the long haul. It's not going to happen overnight. This isn't a short-term fix. This is really getting in and digging your heels in and helping folks understand where the country needs to be, where they fit into that, and how they're going to make the transformation. Because at the end of the day, most of what needs to happen is not the technology. It's there. It's how to do it, how to make that shift, how to move your company's processes, its culture, how it gets things done to a digital way of doing. And that's just not something that it's easier said than done, I should say it that way. So that's why I formed MTC Group LLC. We're a teaming group. I don't have employees. It's a group of my colleagues that we've worked with over the years. So after 30 years in healthcare, I have developed, you'd imagine, a fairly robust network. And it's folks like yourself, Jim, that I partner with to bring solutions to the industry and help others bring solutions. So I'd like to bring value to the ecosystem in ways that I think we're at the national level. I think I can do it now at the local level.
Well, thank you for that. One thing you mentioned there, Rick, is the issue of digital transformation. And so if we go back 30 years, the entire healthcare system was essentially paper-based. I guess some of the reimbursement and payments were the first things to kind of go electronic. But the whole clinical data and everything that's connected to that, we've gone through a massive transformation. And it's not a evolutionary step. It's really a revolutionary step to do this digital transformation. And so I know some of the work you do is around this digital transformation, assessments and planning for organizations. Can you give some examples of what is meant by digital transformation and what the steps might be in an assessment?
Sure. I mean, I don't want to offend any others out there that might look at it more holistically or very complicated. There's ways to look at this, slice and dice. What does it mean to be transformed? What is digital transformation? I would put it in this regard. I mean, there's a lot of folks that will focus on all the different technologies, whether it's remote patient monitoring, whether it's algorithmic, AI-based predictive modeling. Yes, and yes. All that's included. To really put it in stark, simple terms, the KISS principle, right? Keep it simple. And I like to use that last shorty because it's very indicative of my stature here. The real simple perspective here is that it's just about the experience. It's the customer. It's making the customer experience and staff experience. You got to be careful with that one, because if your staff experience is all manual, right, how can you have a digital experience for your customer? But really, digital transformation is about making that experience from beginning to end. And when you think about that, you can go all the way from what does it mean when you have a patient engagement from the very beginning of the, when you first are their first experience. What do you normally go through? You get handed a bunch of forms to fill out, don't you? Sure. Almost without fail, in almost every clinical practice you go to, whether that's a dental practice or outpatient setting for, let's say, your primary care doc, you're going to fill out tons of paper. In today's age, that just seems ridiculous, quite candidly. Why are we still awash in paper? Well, because that's just where we focused our attention, and that's where we've invested our time and money. But that's where it begins. It's like assessing that experience from beginning to end. And I think the companies that are going to get it right are doing that. I think you can use Uber as probably a good example of, where we want to be as a healthcare entity and where we are. If the two be, let's say Shining Star is an Uber example where you go on your phone, you say where you want to go, and it basically does everything it needs to do for you and connects you with the right people. It connects you with the right places to go. And that's that navigation system, right there in the palm of your hand. We need the same thing for healthcare. And that's until we get there with asymmetric data flow between those that have the data now, those that need the data, i.e. the customers, and access to that, to have an informed and engaged consumer. That is where the digital transformation actually happens. That's a tall order for a lot of folks out there, quite candidly. So this is, like you said earlier, this is not a revolution in many ways. It's going to have to be an evolution because it can be very expensive to go from where you might be to where you want to be. And others have been doing this in many ways. Particularly integrated delivery networks have a jump on that, because the integration of processes and the flow between the different compartments or pieces of the delivery system, the more integrated they are, obviously the less, if you will, in some ways, challenging of a lift it is. But when you have to integrate and interoperate with everybody that has their own processes, their own data systems, that's where the challenge is going to be. And quite candidly, that's got to be, I don't know the percentage, but I would put 90% or better of the country is still in that state. Very disparate data systems, very disparate processes, and very disparate outcomes.
One of the things, and I kind of harken back, Rick, to my experience when I worked with a major vendor and did implementations into large clinical practices, is that there was some not aligned expectation of what it was really going to cost. And so especially a large hospital or hospital system that is converting to a new EHR or implementing or rolling out some new technology, they may think it costs one thing, but they get halfway through it, and there are a lot of line items that they weren't aware of or things that come up. And so just the financial planning side of things and expecting the unexpected is a big deal.
Oh, absolutely, Jim. Good point. I think there's a total, whether it's unawareness or just misinformation, or take both, that folks get into this and think, oh, I'll just buy this piece of software. I'll just buy, this system, and that'll be it. Put my EMR in place. That's the least amount of your cost, actually.
Yes.
The real cost, right? The real cost is your people process. The technology, sure, it's going to cost. And that's the thing that folks see right away, because there's licensing costs, there's implementation costs. What a lot of folks overlook is the staffing, training, the upkeep, the resiliency investments, the security investments, the whether it's upgrade or attrition, in terms of the staffing, the data growth. There are just a number of things that folks fail to foresee that in the total cost of ownership. So you're absolutely spot on that when we talk about this, it's their business model assessment that you really should be starting with, and how that really disrupts everything they've done from beginning to end. And what's interesting, this is an and equation. A lot of folks think, well, I'll just install the system. I can throw away all my paper. I can throw away my manual processes. Quite candidly, you can't do that, because, what happens, technology is great, what they say, as long as it's working. Okay, but what happens when it's not working?
Yes.
So there's a whole nother layer of cost, to your point. There's a lot of folks that just forget that, and they throw away all of these things that they learned in their manual ways, and they get very comfortable on that. And you have let's say a disaster come through, and next thing you know, your system's knocked out for, who knows, weeks, and you can't figure out how to go from point A to point B anymore because you haven't done any manual processing or tested your resiliency, unable to do that. So that's another cost to your point. It's an added part. Go ahead.
Yeah, well, you mentioned the word disruptor or disruption. Even in the best of circumstances, when a new system is implemented, the productivity goes down initially. because everybody's having to do these, whether it's do referrals or documentation or whatever they're doing. It takes a while to get up to speed. So there is disruption just in the productivity during that transition. No doubt about that. Let's hop on to another subject, because there's three big ones that I want to talk with you here today. We kind of covered at a high level digital transformation. I know you're also involved in primary care optimization. Is that kind of the same thing? What's that? Is it important? What are the benefits of this concept of primary care optimization?
Sure. No, that's you can look at primary care optimization as a concentrated, focused area on a product in some way. So if your business is healthcare delivery and your product is primary care, as an example, that particular part of your business is a product service that is just like what we got done talking about. In some cases, digital transformation is key, but there are certain things around primary care delivery that you want to strategize around, like how are you going to do your population health? What is your assessment of your population? Do you even know how to do this? Do you have the data? Do you have the infrastructure to even understand the kinds of things you should be doing within your primary care patterns? Is it just becoming a PCMH, a primary, a patient-centered medical home? Is that the answer? Could be. Is it being the comprehensive primary care program member? Is it advanced primary care? There's all these particular specific ways that you could optimize yourself as a delivery. And I look at primary care optimization as don't just take whatever's on the shelf. You have to customize. That's why I call it primary care optimization. You have to customize what you do for what your population's needs are, what your staffing can do, because there may be things you cannot do. There may be things in the local area that are not available. You may be in a particular environment, very rural, which then we can get a whole other discussion about how you might approach and what strategies you might use to optimize your primary care delivery. You might be in an urban center. There's just all kinds of different ways in which you should consider how you optimize what you do. I think what the country did is, in some ways, and I was a part of that, as you know, being at the National Committee for Quality Assurance, we had the patient-centered medical home as a concept, and it is a great model. It's been around for years, like 50 plus, and at the end of the day, it's fundamental principles, and that's what I think folks miss out. If you stick to the fundamental principles, you'll have a guide, a framework in which to figure out how to optimize your own processes, outcomes, to get the outcomes you're looking for. Your process structure gets your outcomes, right? The Down-to-Bedia model. And that's where we come in and help you assess your clinical workflow. And I team with clinical experts like Dr. Michael Barr and others in the field that I've worked with over the years around what does it mean to deliver good diabetes care or hypertensive care or any other chronic disease that you might be having within your population. But what we notice in many ways is that a lot of primary care folks are in a reactive mode. They wait until their patients come to them or they are there for a visit. And then that's when they do the engagement. And it has to start further upstream if you really want to get ahead of your service delivery model, because by doing it by chance, and that's where you get the churn and earn, I think the fee for service model, it's like every visit counted, right? And that's where things are changing in a primary care optimized way. If you're not there yet, you're going to have to get there, because value-based payments, value-based contracting is going to change the way you fundamentally deliver care. And primary care has a place and time where it can actually be, from my perspective, it can actually be the game changer in our delivery system. If we don't start there and we don't start valuing what primary care can do for our ecosystem, I think we're going to miss the boat as a country on changing from a fee-for-service model to a value-based model. And I think the CMS has already seen that. And if you read the tea leaves, if we don't do it as an industry, I think CMS is going to drive us there, whether we like it or not.
Yeah, definitely there is a shift in this whole, fee for delivery to fee for value.
Yes, sir.
And the wave is getting higher, and it's not going away, and everybody knows that. There's no debate about that whatsoever.
Correct.
Let me turn the conversation, Rick, to something else that probably 10 years ago in healthcare information systems was not an issue, but is a giant issue now, and that is cybersecurity. How big a deal is this? What's the stuff about ransomware? What about assessments and audits and policies and procedures? What's the status of this out there? Are hospitals doing what they need to in practices, or are we in trouble?
Well, we've been in trouble for some time. I think we've known that. we the public and even we the folks in it have known that for some time. It's just becoming more and more exacerbated. I think the pandemic with all the remote workers and all that good stuff has really shone a light on just how woefully ill-prepared we have been in healthcare. Look, healthcare has a third of all the breaches in the U.S. An average cost of a breach is like $8 million or $500 per record. So, you guys can do the math at your own locations where you might be, and the cost of avoidance should be enough to scare any board or any other management team to pieces about what could potentially happen to their, brand, their name, and, better yet, their patients. I mean, this comes down to the safety of your patients in many ways. These ransomware attacks, shutting down health systems, it's getting way, way out of control. And these things are avoidable, actually. It's very unfortunate. And I think there's going to be folks that are going to be still caught off guard if they don't get their hands around this. And I think getting your hands around it just comes down to really two simple terms: due diligence. If you are in a management responsible position, whether that's a board of directors or a management team, and you're not holding your teams accountable, and that just comes through good old-fashioned due diligence, I believe the penalties are going to get more severe than ever before. It's the Office of Civil Rights around HIPAA, I think have started down this path. I believe that the wall of shame, halls of shames, if you will, where the breached entities are getting named. I believe there's going to be huge motivators if they're not already for some. This is where, to me, it's really basic stuff, right? I mean, yes, you have to do the blocking and tackling. That's the basic stuff. You have to hire the right people. They have to be on their game.
Yes.
Those are what I call table stakes stuff, right? These are table stakes stuff. And the simple stuff is just not happening. I think this is where, to your question, where for a person like myself can be very helpful to a team, whether that's the board of directors or whether it's the management team or both, where you hire a third party to come in. They help you assess where you're at. They give you, an unobjective third person opinion about where you want to be versus where you are. Now, there's the where you need to be, and of course there's the mandates. Okay, you can go in there and your strategy could be, I just want to be compliant. All right, well, that's great if that's all you want to do. I guess I would call that sort of checking the box, and I wouldn't recommend that, but that's certainly a strategy that people use. I would flip the switch on you, and I would say, don't look at it as a compliance issue. Look at it as a culture issue. Look at it as a competitive advantage issue. This cybersecurity is the way it needs to be embedded in the way you work. It's not an IT department responsibility. It's not a cybersecurity officer responsibility. It's not a privacy officer responsibility. It's a we responsibility. And quite candidly, the highest risk factors are the we. It's not your IT department. It's the actual users. They're the ones that are most vulnerable, in particular your executives, to phishing attacks, to spear phishing, to ransomware, to the things that are causing these unintended consequences where you're going 8-10 months before you realize you have an intruder in your system. That's completely inappropriate, and you need to again. These are the kinds of things where you're not going to stop a breach, quite candidly. If there's enough time and enough focused attention, you will experience some sort of a security incident where someone has attacked your network. If they haven't already, and you don't know it, then they're there and you still don't know it. Meaning there are really only two kinds of companies out there. There are those that have been breached and those that have been breached and don't know it, right? Yeah. In other words, they've been breached and they know it, and those that have been breached and don't know it. Right. Because there are far too many ways to get in. So you have to still have defense in depth. But at the end of the day, you really need to be preparing yourself to yes, prevent, but more importantly, detect and respond. That's where you're going to make your, I would say, value to the organization. How quickly will you be able to detect that you have an intruder, something wrong, something different, someone's peeking in something they shouldn't be, something's not right. I'm noticing more and more inquiries in a particular system that weren't there before. And this all begins with, from my perspective, when I engage a client, their understanding of their data, their assets, their resources, and what needs to be protected. It's amazing to me that a lot of companies still today do not even understand the basics of what they have and the value of what they have and what needs to be protected and where they're focusing their attention. Most of the companies I end up talking with about this, well, I bought this new firewall, or I bought this new system, or now I have this new SEIM, right, or I have this new router, or I have, you name it, right? This new technology gizmo. Yet they're not even doing basic stuff like training their staff on phishing attacks, or they don't have any policies on what it means to have, trusted or not trusted identity authentication management going on. So these are the kinds of basic things that frameworks help, whether that's high trust, whether that's NIST, whether that's ISO, you name it. I named high trust as sure, on the same level as the other two. And I didn't mean to imply that. High trust, right, is, as you most will know, is a amalgamation of the other network or the other frameworks. And high trust itself provides you a framework by which you can manage it. So I label those because those are acronyms that many are familiar with in the industry, and they help you as an organization, first of all, give you a pragmatic guideline to follow, as well as a way to judge and measure yourself in progress. Gotcha. Right, in maturity, sure, of your security. So it is an area, I think, to your point, Jim, that it's not going away, and it's just going to get worse if people don't get a handle on it.
Right, it's critical. There's no doubt about that. Rick, hard to believe, but we're almost totally out of time. But before we sign off, where can listeners go if they want to contact you or learn more about the services that the MTC Group provides?
You bet, Jim. Thanks for having me on today, and I appreciate it. If anyone's looking for, again, assistance in any of these areas that we talked about today, you can reach me at rick@mtcgroupllc.com. M as in more, T as in Dan, G as in group, LLC.com. Well, great. And MTC Group. Yep. Thanks for our audience joining me on this episode of the Tate Chronicles. I offer a special salute to my guest today, Rick Moore of the MTC Group. Rick, thanks for coming aboard today. Thank you, Jim. I appreciate it. You can find more information on this show's program page at healthcarenowradio.com. Until we meet again, here's wishing you smooth sailing and safe harbors.
Tate Chronicles transmission ending now.